Hello everyone! In this video, we'll discuss the intraoperative nursing care for a woman undergoing an emergent cesarean birth. Emergent cesarean means bigla, usually dahil sa complications like fetal distress or cord prolapse. Emergencies like this happen quickly, kaya dapat prepared tayo both technically and emotionally. In situations like this, the role of the nurse is very important. We need to ensure the safety and comfort of both the mother and the baby. Let's walk through these steps clearly and simply para mas maintindihan natin at ma-apply sa actual clinical setting. Since emergency ito, initial assessments like vital signs, urinalysis, and blood work are usually already done. So anong focus natin bilang nurse? First, of course, we need to secure the informed consent para inform si mother sa procedure na pagdadaanan niya. Second is ang application of SCDs or elastic stockings if advised ng doktor. Next is ang insertion of bladder catheter para madrain ng urine ni mother. Next is iset up ang IV line for better administration ng mga medications. Next is gastrointestinal preparations like NPO status or antacids if ordered. These quick but critical actions help stabilize the patient and prepare her for the OR. And remember, habang ginagawa natin ito, dapat kalmado at malinaw tayo mag-explain sa pasyente. Now that she's physically prepared, let's talk about the anesthesia part. Once mommy arrives in the operating room, the surgical nurse will assist her to move from the stretcher or bed to the OR table. If she already has an epidural catheter from labor, make sure hindi ito matatanggal habang nililipat siya. Ingat sa movement, nurse! During transport and even while inside the OR, we need to make sure na hindi siya totally nakahiga. Encourage her to lie on her side or maglagay tayo ng unan sa ilalim ng kanang balakang. This is to prevent supine hypotension syndrome or yung biglaang pagbaba sa blood pressure kapag diretsong nakahiga. For emergency cesarean deliveries, spinal anesthesia is usually given. Here, the anesthesiologist will ask the patient to sit up. As a nurse, our role is to support the patient while she's sitting. Help her curve her back or mag-arcing position para bumuka ang spine and make it easier for the spinal needle to enter. Let her lean on you habang kinakausap mo siya. This will help her relax, especially kung may contractions pa. Now, if it's epidural anesthesia, the patient is usually asked to lie on her side. Often, a medication called Duramorph, a type of morphine, is added to the local anesthesia. Its effect can last up to 24 hours. That's why it's commonly used to provide long-lasting pain relief after surgery. But take note, Duramorph can cause late-onset respiratory depression, meaning delayed breathing problems. So it's very important to assess respirations every 2 hours post-surgery. Also, use continuous pulse oximetry for 24 hours to ensure mommy's oxygen levels are stable and safe. Next step, skin preparation. Cleaning the surgical site reduces infection risk. We shave hair if needed, cleanse with antiseptic like iodine, then apply sterile drapes. May screen na nilalagay near the chest to protect the surgical field and help calm the mother para hindi niya makita ang incision. Now that everything is prepared, let's look at how the incision is done. May dalawang common types ng cesarean incision. The classic or yung vertical incision, ito madaling gawin pero risky sa next pregnancies dahil dumadaan sa upper contractile part ng uterus. Then yung horizontal incision or most commonly known as bikini cut. Ito mas safe at common dahil less blood loss, less infection at pwede pa for VBAC later on. Important reminders lang, minsan magkaiba ang skin at uterine incision, so don't assume just by looking at the scar. After the incision is made, it's time for the delivery.
Pag nabuksan na ang uterus, tinutulungang ilabas si baby. Head first, then the rest of the body. Usually, sinasuction muna ang mouth and nose para sure na clear ang airway. Habang nilalabas si baby, binibigay ang oxytocin IV para tumulong sa pag-contract ng uterus and reduce bleeding. Sa ibang bansa, support person may even be allowed to cut the cord. After delivery, it doesn't end there. May kailangan pa tayong i-check sa loob. After delivery, the uterus is lifted out, cleaned, and checked for placenta or membranes. Kung may contraceptive plan si mommy, like IUD or ligation, pwede na itong gawin now. Then, isa-isang sinasara ang layers. Uterus, fascia, subcutaneous tissue, at skin. Dapat i-remind si support person na matagal talaga ang closing stage. Normal lang ito dahil maraming layers ang dapat i-secure.
Kapag stable na si baby, pinapakita agad siya sa mom and support person. Skin-to-skin contact is encouraged kapag okay na ang lahat. Pwedeng magpa-breastfeed usually kapag tapos na ang anesthesia. That is approximately 4 hours after surgery at nailipat na si mom sa recovery room. As nurses, our support doesn't stop after delivery. We help facilitate bonding, observe for complications, and continue educating after surgery.
So ayan, that's the flow of intraoperative nursing care during an emergent cesarean birth. From quick pre-op actions to delivery and closure, every step we do counts towards the safety and emotional well-being of the mother. Thanks for watching. I am Rain Samaroque and I hope this video helped clarify our role during this crucial procedure. Padayon, future nurses.